In the past, unlike conventional hospitals, job responsibilities were not clearly defined in here. All the doctors, nurses, occupational therapists and social workers did what they were able to do to help the patients. As everyone was willing to work with that flexibility, we could improve manpower deployment and treatment to the patients. On the whole, patients from Castle Peak Hospital very much appreciated Leitchikok Hospital. It was because the living environment was better in here than in the old Castle Peak Hospital. Leitchikok Hospital was a bit different from the other long-stay care homes. Psychiatric patients here needed space to move around. They couldn't just lie in their beds all the time. Therefore, when we planned our area, we had to reserve space for facilities like halls, workshops, etc. Patients could therefore carry out normal activities. We put quite a lot of effort in changing the dormitory into an occupational therapy department. In there, we had workshops and equipment to assist patients throughout the recovery process. When I took office, we already had a well-established cooperative society run by the patients. For example, a kiosk where patients could learn how to prepare snacks for sale. That is what couldn't happen in a conventional hospital. If a patient could walk around, go out for groceries and cook instant noodles for himself, he wouldn't need to be in the hospital. But it was not the case in a psychiatric hospital. We had activities for both patients and staff to enjoy festivals together. For example, at Christmas, we invited volunteers to give our patients some entertaining shows. We arranged these kinds of activities quite often. Many of our staff came to recognize the full value of the job they were doing. As time went by, Leitchikok Hospital changed from a place that eased the crowded situation in Castle Peak Hospital to a hospital that had its own community rehabilitation settings. I think Leitchikok Hospital utilized every resource to its full potential and did a good job indeed.